Hi, everyone. Welcome. I'm Julie DiBiase with the Prostate Cancer Foundation. Today, we are with June Chan, who is an epidemiologist and professor at UCSF. Welcome, June.
Hi.
June is also one of the contributing editors on our wellness guide, which some of you may have read. And June is here to talk to us today a little bit about exercise and prostate cancer. So June, start out and tell us, just give us sort of a general overview. What do we know about exercise and prostate cancer?
Sure. So the bottom line these days, actually, with regards to exercise and prostate cancer is that exercise after diagnosis does offer benefits for reducing the risk of recurrence and prostate cancer specific and all-cause death. And so actually this started with publications that I and my team led back in 2011. And we published in two separate populations findings that different forms of exercise could offer benefit for prostate cancer recurrence and death after diagnosis. And then since then, over these last several years, there have now been a good handful of studies that have really confirmed that result and provided further details for us regarding the potential benefits. And it's actually at the stage now that in the updated physical activity guidelines from 2018 put out by the American College of Sports Medicine, there's a specific call out in a table that actually lists that exercise is specifically recommended for men with prostate cancer to lower their risk of dying from prostate cancer. So we're really excited that we got to contribute to that work and that the subsequent papers have been consistent in that finding.
That's fantastic news. We're so grateful for the work that you've done on that. I know that all the men out there are also really grateful for it. Dig into a little bit more detail. Tell us a little bit about whether there's any differences between the types of exercise you do, the duration, the intensity. Do we know any more details about what's the best?
Yeah, that's a great question. So in the early papers, the first two papers we worked on, one of the findings that had showed the reduction in men with prostate cancer for prostate cancer specific death. It was novel at the time, first time that had been reported, but the benefit was really reserved for men who were exercising quite intensely and for quite a long time. So it was at the level of men saying that they were jogging like 1 hour, 6 days a week. And so the good news though from that same report was the benefit observed for all-cause deaths. So these are still yet again men with prostate cancer, local regional cancer at diagnosis, but there was still a benefit for all-cause mortality, not at a much lower level. So something more like 30 minutes of walking most days of the week. So that seemed more doable. Another study that we published at that time was looking at walking pace, and it really seemed to suggest that brisk walking, sort of like 30 minutes a day, 3 times a week, offered protective effects against prostate cancer recurrence. But the general trend from those early studies was, okay, you got to be either doing it kind of intensely or intensely and long. So it seemed a little bit hard to think about, masses of people making those changes. But I should say that the subsequent papers, there's been now, I think, 3 papers, a Canadian cohort, another US-based cohort, and a Swedish cohort. At least 2 of those observed similar prostate cancer specific death benefits at much more moderate levels of like 1 hour of regular exercise a week. One of the studies suggested you did need to be a little bit more intense, but 2 of them, were seeing a benefit even at really much more reasonable, attainable levels for an everyday person.
That's great. And that's sort of a great lead into, we wanted to talk a little bit about this month, June, we're doing our first annual Walk the Bases Challenge, where we're asking anyone to join in to raise awareness and funds for prostate cancer research. All you have to do is walk 41.5 miles in the month of June. Anyone, it was designed so that kind of anyone could do it and still reap all the health benefits of walking. And so we're 2/3 of the way through. But people can still sign up. I just signed up a couple of days ago. So for me, it's I got to do about 4 miles a day for the rest of the month, which is a lot. But our other participants, people have really been getting excited about it and they've been getting into it. So talk specifically a little bit about kind of what would you recommend to push people in those last 10 days? And what else can you say about walking? Because we've seen people get so charged up about just walking.
Yeah, I mean, walking is so common. Like, this is things we do in our everyday life. And I could say, during these COVID times when we're confined to small spaces, people may find it difficult to walk the way they would prefer or they would enjoy. But I guess I would say, just use it as a break to get fresh air. Even if you're just going up and down the same block and pacing, I would say that every little bit counts. Any little bit of walking as opposed to sitting likely is beneficial, not just for prostate cancer health, but we know that it's, your overall movement and bone health and flexibility. These kinds of things are important. So I think, and also for people who've joined late, I would just say, it's great that you've joined, and don't feel like I would not push yourself, to injury to get to that 41 miles necessarily, but just use it as motivation to get into a good habit or routine.
That makes me feel better.
Yeah.
Always it as
what I like about walking, it's something you can do while you're doing something else. So a lot of times I grab my phone. Anytime if I'm taking a walk, I grab my phone and I use it as a time to catch up with somebody, and it becomes really easy to get in those steps, I think.
That's great. And people can still go to PCF.org to find out about registering. And, I have my prop right here. I have my pedometer. So tell me, how do you feel about people using pedometers or not using pedometers? Are you a fan? What do you think?
Yeah, I really think it's a personal preference. I think if you're just starting, it can be a great motivational tool. I know from like personal family anecdotes, when older relatives have just gotten their knee replacement or something and there's recommended movements, it's really nice to be able to see, okay, this week I could do 1,000 steps a day, and the next week, you're healing, you can do 2,000. So I think it can really be good for people if they're not used to tracking those things. But I also wouldn't say that, after a certain point, especially you start to learn like, oh, I know that my walk from here to that store is typically half a mile and this many steps. And I find a lot of people say, like, I wore it for a month, it was really good because I know what these benchmarks are. Not, I think then it's up to individuals if they really feel that they need to continue tracking like that.
Because, one of the things we talk about in the Wellness Guide too is, de-stressing and relaxing. So sometimes if you're always looking at your watch, you're not enjoying the walk as much.
Exactly. Yeah, that's why I think I prefer to do other things when I'm walking, like, in other times when it's not COVID, it's great to be in parks or, go for a hike or something like that. It's a little bit harder these days if you can't get to all these places and park.
Right. So for anybody that has gotten super charged up from the Walk the Basis Challenge and wants to keep up the good work, do you have any recommendations for helping an individual establish a year-round walking plan that might work for them, or exercise? Doesn't have to just be walking.
Yeah, I mean, in general, if someone has not exercised regularly for a long time, it's always good to, either consult with a physician or an exercise physiologist, personal trainer, just so they can assess. I think for a lot of people, if you haven't done a lot of exercise in the past, especially for older adults, there's usually other issues going on, or there can be other issues. So it's good to get a program that's sort of tailored to fit where you're at. And I think there's great exercise specialists who can do that. It could be completely unrelated to prostate cancer, but you've got a lower back issue or a little bit of a knee issue, and you really want to be careful so that you don't overdo it, I think. I mean, that's my own sense, is like, you don't want people to overdo it and then get injured and then just sort of lose all interest in continuing. So I think it's really important to sort of get tailored recommendations to where you are. In general, if you're not doing that or you don't feel that you have to do that, I just think the general advice is always just start small, look at your increments, go up by like 5 to 10 minutes per bout. If you feel like you've done that, you can go for a little bit more intensity. So that is where having like a Fitbit or something like that might be helpful, so you can look at your average pace. So there's distance, there's duration, there's pace. And I think you just sort of start small with what feels good for you and then make small incremental changes, every week or 2 weeks.
Yeah, once again, fantastic advice. So tell us, so we're very proud to have funded some of the foundational work that you've done on exercise and prostate cancer. Can you give us a preview? Can you give us like a sneak peek into sort of what's coming up, what's on the horizon? What are the next most interesting topics of research that you're going to study?
Sure. Some of the studies that we are still working on, and we're grateful to PCF for all the ongoing support, really are kind of diving deeper to try to understand what are the underlying biological mechanisms that might be at play for why exercise appears to have these benefits for prostate cancer specifically and overall health. Is it a systemic effect? Is it an anti-angiogenic effect? Is it acting on oxidative stress pathways, excuse me. So we have a good handful, small handful of studies that are looking at biological specimens taken before and after intervention studies. So that's one type of ongoing research. There is actually a really large phase 3 prostate cancer clinical trial going on regarding high intensity exercise in men with metastatic prostate cancer. So this is the Movember supported GAP4 or interval trial, which is global. And the goal is to enroll 866 men with metastatic cancer worldwide. We have more than a dozen sites on board, I believe, in multiple countries and multiple languages, actually. So this study is really looking at a 2-year, so much longer intervention, a 2-year tailored intervention for men with metastatic prostate cancer. It has both strength and aerobic components, and it's looking at the outcome of overall survival. So it's a big study, it's a very ambitious study, and it's going to take time to accrue and have the full follow-up, but that is in the works.
So, you know, in our wellness guide, we talk a little bit about high intensity interval training. We touch on in the guide ways that you can, you know, you don't have to be a runner or a biker or an Olympic athlete to do this kind of high intensity training. But for people who don't know, talk about, for the purposes of the study, like how do you define high intensity training?
Yeah, so for this study, it really, to be in the study, actually, participants need to go through a number of sort of safety screens to make sure that they are, that it's appropriate for them to exercise at high intensity. That does actually include like an exercise test where you push somebody to their limits to see where they're at, to make sure that it's safe for them, and then tailor. Personally, not an expert in high intensity interval training. So I would say, you know, if someone is interested in that, that would definitely be something to check with an exercise physiologist about to begin doing that safely.
Is a trainer good enough, or do they have to actually go to like an exercise physiologist, do you think?
I mean, the typical recommendations is like talk to your doctor, health professional. I think an exercise trainer, I do think there are individuals who specialize in exercise for people who have cancer. I actually do think that might be important if you can find someone who has that certification, just because especially if you're older adult, still on treatment, still perhaps for cancer or with metastatic disease, I do think it is important to think about safety. I would not necessarily go to your general personal trainer at a gym who's not used to catering to first older adults or patients on cancer. In the trial, you know, especially because all the participants have metastatic disease, a lot of attention is given to exactly which types of exercises that individual has based on the location of metastases to the bone. And so it's actually, for that particular patient population, I think it is important to, you know, consult both with a doctor and a specialist, an exercise specialist.
I think that's a great point to make. The idea that maybe if you're a survivor who's like, you know, 5 or 10 years out from treatment is really different than either in treatment or having just finished treatment. So always consult with your doctor. Now, let's kind of round this out. In our wellness guide, we talk about making sure that you rest your body, that you exercise, and that you eat well. So what are like your top 5 eating nutrition tips to kind of round out, you know, if someone's doing all this great exercise, how do they make sure that they're rounding out their health routine with some really healthy eating?
Sure, and I think a lot of this information is in the guide, actually, I think. But for diet, you know, we kind of have similar recommendations to a general healthy diet for men with prostate cancer. So I think lots of vegetables, a lot of variety on the vegetables, plant-based fats like avocado, olive oil, nuts, focusing on whole grains over refined grains, high fiber diets, so including beans and legumes in your food, And then things that are not necessarily central to prostate cancer, but we know that are very important for health, which would be, if you really need to have sweets, try to get that from natural fruits rather than sugar sweetened beverages or desserts. Kind of try to get into a habit of saving those things more for special occasions. We generally emphasize and recommend more like fish and lean skinless chicken or poultry instead of red or processed meats. And then avoid whole milk or high fat dairy, which actually has been something that's been studied a lot for prostate cancer.
That's fantastic. So any last words? I think this is just going to be a fantastic resource for those people who have gotten so energized by walking this past month.
I would just say a good job, and thank everybody for supporting the cause and raising awareness.
Thanks as always, June. We're so grateful.
Thank you.